C.O.B.S stands for Comprehensive Outpatient Behavioral Services, and it was designed in order to try to provide a unified service area for patients who have mental health needs.
The mission in C.O.B.S is really to serve as many children as we can in both Suffolk and Nassau County. Children come to us with psychiatric illnesses, and our goal really is to stabilize not only with medications, but through group therapy, family therapy, and individual. The unique mission that we have is to do this in the home. So we actually visit the homes of all the patients who come into our clinic.
We provide therapeutic services for the children and their families, as well as medication management. We do case management working with the schools in order to help families stay together.
There's a large community of children and adolescents who need both therapy as well as medication management, diagnostic evaluations, school consultation, really working with families, with schools, with the patients themselves, and with outside support systems to try to deliver comprehensive care to our patients. And that's really what our goal is to give them the most comprehensive care that we can.
So my role here as the director is to help ensure the daily functioning and operations of the clinic. I provide supervision to all the counselors. I work with the families as well when there are problems. I also work with inpatient and our partial hospitals in order to assure smooth transitioning through the entire service line at our hospital. I work on budgetary things and program development for the department.
Our intake and evaluation process is done with an extensive set of questions to get an understanding of the individual's history, the family's history, and the presenting concerns so that we can find out the best ways to help them moving forward.
My role as the administrative director of C.O.B.S is to really provide a seamless garment of services between our inpatient services, our partial hospitalization, and our outpatient. So by overseeing all three programs at South Oaks Hospital, I'm able to assure that any patient that gets admitted inpatient will have their services fulfilled and seen through the outpatient services. And there's a warm handoff so that the patient is not coming into a clinic for the first time, not knowing anybody, but they've actually met their caseworker. They've participated in their discharge plan in the hospital, so that when they come to the clinic for the first time or meet their counselor in their home for the first time, they have a recognizable face.
We were designed really to take patients who might not have been able to afford to go to a private facility. So we are a clinic, and what we do is we take patients in here who need therapy but may also need medication management, and we work as a team. We don't believe that you can have something, just have medicine as the solution. We really believe that it should be a comprehensive approach to treating each patient and their families.
Well, I work with both children and adolescents that deal with dual diagnosis. That's both substance abuse and mental health.
So when someone wants to become a patient at C.O.B.S, they can either be referred by the hospital, any hospital really, a school, or on their own if they look us up in any kind of resource book. The process would be that they would call our main number, 608-5900. They would be set up with an initial intake where they would come in with a family member, a parent, guardian. They would come for an evaluation where we would do about an hour and a half assessment, where the clinician will go through a history, take a psychosocial, and determine what the family's needs are. After which we would review the case, assign it to the appropriate counselor, and determine whether or not services would be provided in their home or here on site. And then once they become a patient, we determine the need for psychiatric services if they are needed, at which time we would then have a psychiatric evaluation done.
So when they initially come in, they meet with a social worker like myself or another mental health counselor, and they do an extensive group of questions to kind of get a good background of their history, family history, what kind of the current, concerns are, and we kind of get a good idea of how we can help them moving forward.
Our youth is, the age group is anywhere from birth, if you will. We have a perinatal clinic all the way to 21 years of age. And the people that come to us have different diagnoses. Some have mood disorders and others have chemical dependency disorders, and some have a mixture of both. A lot of the children that come to us and the adolescents have problems in the community and problems in school, problems at home. And usually through the medication that we provide, we're able to stabilize the symptoms of their various diagnoses. But once again, working with the community, working with the family, we're able to return that person to a productive life in the community.
Some of the groups here at C.O.B.S are diversity group, a coping skills group, a healthy decisions group, a social skills for exceptional teens group, and an in-betweeners group. All these groups, kids come and they can at least talk to other peers about their problems, and you know, it just helps them express themselves when other people have the same or similar problems as they do.
We have some young people that come in with anger and, you know, substance abuse issues, and they're really struggling in school. And we've gone into the school as well as into the home and worked with these individuals to try to create the best plan for them. And through that, they've graduated high school and moved on and are going to college successfully with positive relationships and, you know, being abstinent from substances. And so you see this individual progress from a place where they, you know, really couldn't function with other people, and now they're in a place where they're really thriving and have matured and gained a lot from working with us as well as working on themselves.
Primarily what we're seeing is a lot of suicidal, parasuicidal kids, a lot of children who engage in self-injurious behaviors. We're also seeing a lot of school refusal kids, so we work with the families to get these children back into school. We've started a DBT kind of group where we work on skills trainings for these kids to help them stay safe. We also work very closely with their schools, their pediatricians, and any other people in their lives so that we can be sure that there's consistency in their life throughout, and that we can help them best both at home and here.